Welcome to Easy Anatomy. Now I'm going to talk about Sphenopalatine Ganglion. Sphenopalatine Ganglion. This is one of 4 parasympathetic ganglia located in the head. We had otic ganglion, which is related to glossopharyngeal nerve and provide parasympathetic fibers to parotid gland through auriculotemporal nerve. We have submandibular ganglion, which is located in the submandibular region and responsible for parasympathetic supply of submandibular and sublingual salivary gland. We have ciliary ganglion, which is located in the orbit, and it is related to oculomotor nerve and provide parasympathetic supply to smooth muscles of the eyeball, like sphincter pupillae muscle and ciliary muscle. Now, this is sphenopalatine ganglion located. Where it is located? It is located in trigopalatine fossa. This is the site in trigopalatine fossa, and here is the trigopalatine fossa. If you remember, is located here. This is the infratemporal fossa. This is the trigomaxillary fissure, and inside here trigopalatine fossa. So the sphenopalatine ganglion located in here. So for any parasympathetic ganglia, as I mentioned before, you need to remember that it has 3 roots. One is sensory, and in our case here it is coming from V2 maxillary nerve. One is sympathetic, which coming as postganglionic fibers from superior cervical ganglion. Then the functional root, which is the most important root, is parasympathetic, and the parasympathetic root is coming from greater superficial petrosal nerve, a branch from cranial nerve number 7, facial nerve. Okay, so here is the sphenopalatine ganglion. So we start with the most important thing, which is again greater superficial petrosal nerve, and it is the only root which is stop here, and the postganglionic fibers are going to different glands: lacrimal, palatine, and nasal. Lacrimal, palatine, and nasal. So where does this come from? This is a greater superficial petrosal nerve. I would like to give more detail about this nerve. The origin of this nerve is facial nerve, and as you remember, I keep saying that all glands in the head supplied by facial nerve except parotid supplied by glossopharyngeal. So this nerve coming from facial, okay, is going to be joined by, this is internal carotid artery. Around the internal carotid artery there is sympathetic plexus, which considered as postganglionic fibers coming from superior cervical ganglion. This is superior cervical ganglion. This is a sympathetic. Okay, this is sympathetic. Okay, so this plexus around the internal carotid artery send this tiny branch is called deep petrosal nerve. It's called deep petrosal nerve. The deep petrosal nerve is going to join the greater superficial petrosal until it reaches here to this ganglion, and is going to pass through the ganglion without stop, because it is already postganglionic. In this area, in the base of the skull, they travel together in a canal. This canal is called what? Pterygoid canal. It's called pterygoid canal. So this is pterygoid canal. This is greater superficial protrusion nerve, and this sympathetic branch is called deep protrusion nerve. So both of them, they form one nerve here inside the pterygoid canal. We call it Vidian nerve or nerve of pterygoid canal. Either name is correct. Nerve of pterygoid canal. The parasympathetic and the sympathetic, they are going to separate again at the level of the ganglion. And here in this ganglion, Sphenopalatine ganglion, the postganglionic fibers, this red color, parasympathetic fibers, the one going to the lacrimal gland is going to join the zygomatic branch of maxillary. This is the maxillary, or V2, is going to send this branch, is called zygomatic. This is V2. Zygomatic is going to split into two branches. One is called zygomatico-facial, and this is called zygomatico-temporal. Zygomatico-temporal branch. So the parasympathetic fiber is going to continue with the zygomatico-temporal. Zygomatic, then zygomatico-temporal. Then here is the gland, lacrimal gland. The closest nerve to this gland is lacrimal branch of ophthalmic. Here is V1 giving this lacrimal branch. So the parasympathetic continue through the lacrimal branch until it reaches the gland, Okay, so again, how parasympathetic fiber reach to lacrimal gland? It's long pathway. As you see, the postganglionic fibers is going to join the zygomatic branch of V2, then continue through the zygomatico-temporal branch, and from there is jumping into lacrimal branch of V1 until it reaches the gland. So if I ask you, what are the divisions of trigeminal nerve related to the parasympathetic supply of lacrimal? Is it V1, V2, V3, or V1 and 2? V1 and 2, as you see. Here is the parasympathetic fibers joining first V2, then V1, branches of V1. Okay, how these postganglionic fibers, parasympathetic fibers, go to nasal glands? They go to nasal gland through the Sphenopalatine nerve. If you remember, there is Sphenopalatine foramen in the medial wall of pterygopalatine fossa. This nerve travels through it and reach nasal cavity. So through Sphenopalatine branch of maxillary, here is the Sphenopalatine branch of maxillary, this nerve, parasympathetic fiber joining it. Okay, then maxillary send branch to the palate. This are greater and lesser palatine nerves, and those are the nerves which carrying parasympathetic fibers to the palatine glands, So very simple here again, maxillary nerve. If you go and review the branches of maxillary nerve, you will see that there is greater and lesser palatine nerves, and the postganglionic fibers joining them to reach to palatine gland. You have a sphenopalatine nerve, so it is joined also by postganglionic fibers from sphenopalatine ganglion to reach to nasal glands. Then, more importantly, the one going to lacrimal gland is coming from the ganglion, going to zygomatic, zygomatico-temporal, lacrimal, until it reaches to the gland. Okay, so this ganglion is very important because it becomes a target to treat several kinds of pain, including Sphenopalatine ganglion, neuralgia, cluster headache, trigeminal neuralgia, and different kind of pain. So it is easy to block this ganglion. What happened? Usually, you can apply local anesthesia through a piece of cotton without any invasive procedure. If you introduce this, like consider that this is a piece of cotton, you introduce it like here to the lateral wall of the nose until you reach to the sphenopalatine foramen. And when you reach to the sphenopalatine foramen, it means that you have access to the trigopalatine fossa and to the ganglia in the lateral side here. So keep in mind that if you apply anesthesia here in this area, you can block the sphenopalatine ganglion, which is located inside here. Okay? Okay. So sphenopalatine ganglion, again, if it is irritated, it can give you signs similar to common cold or hay fever, because if you irritate this ganglion, it's not only cause headache, but also it is going to be associated with excessive lacrimation and nasal secretion, which you call it rhinorrhea. So basically, this is similar to common cold when you have headache, when you have lacrimation and nasal discharge. Okay, so again, before I leave this ganglion, remember that sphenopalatine ganglion, okay, target to treat several kind of pain, include cluster headache, including trigeminal neuralgia or sphenopalatine ganglion neuralgia. Okay. And basically, you can use non-invasive technique through local application of local anesthetic that access the ganglion through via the sphenopalatine foramen. Sphenopalatine foramen. Okay. What are parasympathetic? If there is any irritation of this ganglion, you can have headache, okay, plus lacrimation, plus rhinorrhea, which is nasal discharge. Okay, so this is a sphenopalatine ganglion. Thank you.